Myself, Dr. Shweta Sonwalkar, Clinical Head and Fertility Specialist at Oasis Fertility, Belagavi Center. Today I am dealing with role of PRP in infertility. What is PRP? PRP is platelet-rich plasma. It is a plasma with many more platelets than what is typically found in blood. So the concentration of these platelets and thereby concentration of growth factors, they are 5 to 10 times greater than the usual. Coming to overview, PRP, it has been investigated since 1970s and it is not new. Autologous PRP was first used in 1987 by Ferrari et al. Reports on the clinical use of PRP have increased since the last decade. Indications for PRP therapy, it ranges from muscle and skeletal injuries, ocular deficiencies, oromaxillary surgeries to hair regrowth. PRP has been used alongside conventional fertility treatments to improve egg quality, uterine lining thickness, and endometrial receptivity, primarily in the treatment of recurrent implantation failure. So the theory beyond this modality of treatment was derived from natural healing process, as the body's first response to tissue injury is to deliver the platelets to the injured area. Platelets promote healing and attract stem cells to the site of injury. From basic science to clinical practice, PRP injection was applied in various fields of medicine with marvelous repair results. The PRP preparation, it is a lab procedure which involves withdrawal of blood, preparation of the PRP, and then injection into the targeted area. PRP is the most often used from person's blood undergoing the PRP therapy, but it can be made from another individual's blood also. So PRP preparation here, about 15 ml of venous blood is withdrawn from the patient's arm in an anticoagulant containing tubes. The recommended temperature during processing is 21 degree to 24 degrees Celsius to prevent platelet activation during centrifugation of blood. The blood is centrifuged at 1800 RPM for 8 minutes for gynecological preparations, and the blood separates into 3 layers after centrifugation. Upper layer contains platelets and WBC. Intermediate layer is called buffy layer, and the bottom layer contains mainly RBCs. Now the upper and the intermediate buffy layers, they are transferred into an empty sterile tube. The plasma, again it is centrifuged for 2400 revolutions per minute for 10 minutes to help in the formation of soft pellets at the bottom of the tube. Now the upper two-third portion of the plasma is discarded. It is known as which it contains a platelet poor plasma, and pellets are homogenized in lower one-third to create the PRP, that is about 6 ml of the plasma. So nearly 30 ml of the venous blood yields 3 to 5 ml of platelet-rich plasma. So in short, the overall process of the therapy is withdrawal of the blood in a plate tube and centrifugation of the blood, then PRP activation, and the prepared PRP is injected into the targeted area. This platelet-rich plasma, it composes many growth factors. The growth factors like platelet-derived growth factor, which helps in the cell growth and new generation and repair of the blood vessels and collagen production. Then vascular growth factor, which helps for growth and new generation of vascular endothelial cells. Transforming growth factor beta, which helps for growth of epithelial cells. Then promotion of wound healing. Then keratinocyte growth factor, which helps for growth and new generation of keratinocytes. Then epidermal growth factor, which causes promotion of epithelial cell growth, angiogenesis, promotion of wound healing. then fibroblast growth factor, which helps for tissue repair, then cell growth and collagen production. How this platelet-rich plasma, uh, what is the mechanism of action of this platelet-rich plasma? The main mechanism of PRP is not exactly clear, but laboratory studies have shown that the increased concentration of growth factors in PRP can potentially speed up the healing process. PRP is superior to recombinant human growth factor in the release of multiple growth factors and differentiation factors upon platelet activation. Recently, the fibrin framework present over platelets was found to support regenerative matrix, leading to rapid morphological and molecular configuration of wound healing. Now, this PRP in cases of infertility, that is IVF procedure, let us know what are the indications for this PRP in gynec practice. IUI and IVF to assist with or improve the egg quality and quantity, to improve the uterine lining thickness and to enhance the endometrial receptivity. It is indicated in patients with a history of recurrent implantation failure with normal endometrium. It is used in poor responders in previous IVF cycle cases. It is used in patients with poor ovarian reserve, patients with premature ovarian insufficiency, in cases of thin endometrium and Asherman syndrome. So, PRP for ovarian rejuvenation, it is a process by which the production of the eggs in the ovaries is artificially stimulated, giving the woman the chance to produce more eggs than they would naturally have been able to, and therefore giving them the chance to conceive using their own genetic material and helping the patient to conceive. So, this has become the brighter side towards all lost hopes. Even for ovarian rejuvenation, the same procedure of PRP preparation is followed, and at the end, about 30 ml of peripheral blood taken in two separate tubes, which gives rise to 3 ml of PRP concentration for each ovary. And this PRP preparation, it is injected into the ovaries either through transvaginal ultrasound or through laparoscopic injection. So the factors which I explained, they help in the production of primordial, to increase the number of primordial follicles and helps in the follicular growth and even helps for the ovulation. So overall, many studies have concluded that the pooled results suggest that the intra-ovarian injection of PRP can promote ovarian regeneration and improve the reproduction outcome of the patients with ovarian dysfunction. This therapy may have significant clinical potential in improving the sex hormone levels, increasing the antral follicle count, oocyte count, and embryo count. However, these findings still require more rigorous and extensive trials worldwide to determine the value of intra-ovarian injection of PRP in cases of poor ovarian reserve patients. PRP in premature ovarian failure. Premature ovarian failure, it is a loss of normal function of the ovaries before the age of 40 with loss of fertility. A team of Harvard University researchers changed this fact when they injected mice ovary with growth factors and appeared to develop mature eggs from ovarian stem cells. So they stated that the introduction of isolated growth factor bearing platelets directly into the ovaries might trigger a resurgence in oocyte production. So this was the beginning of ovarian PRP for poor ovarian insufficiency patients. Now, PRP in cases of thin endometrium, when the PRP preparation is done, Under aseptic precautions, about volume of 2.5 to 3 ml of the PRP obtained was infused intrauterine using IOI cannula under USG guidance. Patients were asked to continue the estradiol preparation in the same dose as before. And PRP in cases of thin endometrium, route of administration is either intrauterine infusion or subendometrial injection through hysteroscopy. And the protocol used for fresh embryo transfer is PRP is infused 48 hours prior to the embryo transfer, while in case of frozen thawed embryo transfer, the endometrium is assessed on 10th and 12th day of FAT cycle. If the endometrium is normal, PRP can be used as slow intrauterine infusion with embryo transfer catheter in all the cases of recurrent implantation failure patients. If it is less than 7 mm and also in previous cycle it was thin and with maximum dose of estradiol valuate, intrauterine PRP is done and assessment is done after 2 to 3 days and repeat another dose if the thickness is not increased above 7 mm and continue the maximum dose of estradiol tablets, and once the thickness reaches above 7 millimeter, progesterone is started and the embryo transfer is scheduled. So overall PRP treatment advantages are it is a daycare procedure. PRP preparation is simple procedure and it is a very fast procedure. Cost of the preparation is also low and autologous nature of the preparation causes no risk of immune reaction to the patient and transmission of microorganisms from other donors. And it has been reported that PRP can improve implantation rate, clinical pregnancy rate, and endometrium thickness in patients with recurrent implantation failure. It can also promote the expression of tissue remodeling genes and reduces fibrosis in Asherman syndrome. Thank you. Are there any specific fertility conditions where PRP is not recommended? PRP is recommended in all the indicated patients. No specific conditions where PRP is contraindicated. Madam, at what days do we do PRP in thin endometrium? In thin endometrium, when we do ultrasound and endometrium thickness is even less on day 10 and day 12 of the endometrial preparation, so we can redo the PRP infusion till endometrium crosses 7 mm. When to see for response? Response is seen 3 days after the PRP preparation. Every third day, we have to follow up the patients. Can PRP be used for male infertility? Yes, PRP can be used in male infertility. That is intratesticular also we can use for sperm production. Thank you.